So in talking about starting what we're going to discuss today on oral plastic surgery, you're probably more familiar with the term periodontal plastic surgery. Periodontal plastic surgery is terminology that was first coined by P.D. Miller and has to do with situations such as excessive gingival display, gingival recession, gingival defects around the dentition, and the associated procedures in order to correct those situations. We've started to use the terminology, at least in my practice and several other practices, of oral plastic surgery, because now we're also encompassing dental implantology into our soft tissue surgical procedures. I think those two things are inextricably intertwined, at least in how I approach it in my practice. And therefore, the title and of the presentation being on oral plastic surgery. Now, let's kind of illustrate the point. So this is a patient that I had performed crown lengthening for aesthetics on. And this is what she looked like before. And then I did take some Photoshop liberties and I created a recession over here on tooth number 9. Now, let's go ahead and remove that central incisor in each one of those situations. And I think you will understand from the illustration that we have 3 potentially vastly different situations that we may approach very differently from the implant standpoint. Now, if we put those pieces back and then we take away a lateral incisor, per se, we still have other conditions in the smile zone that can affect how the overall aesthetics of the treatment is perceived by the patient, by us, perhaps. In 2008, at the request of a good friend, Bob Levine, who I believe has been here to present to all of you, I put together this paper on soft tissue risk assessment in aesthetic, restorative, and implant dentistry. Again, with the idea of blending the concepts of smile analysis